And welcome back. The Affordable Care Act helps small businesses and small tax-exempt organizations afford the cost of covering their employees. If you have fewer than 25 employees and provide health insurance, you may qualify for a small business tax credit of up to 35% to offset your insurance. Now, in 2014, that credit would increase to 50%. Joining me now, Kyle Jackson. He is the Georgia State Director for the National Federation of Independent Business. Kyle, thanks for joining us this morning. All right, NFIB, you guys are one of the plaintiffs in this lawsuit, one of many across the country, right, within their own states, battling this new health care law. What, from your position, is most wrong about this bill, this law?
Well, how much time do we have? There's a lot of things.
Your main concern?
Well, the whole Affordable Care Act is really a misnomer. This law focuses a lot on coverage, which is a laudable goal. It does very little for cost containment, and the number one concern for small employers is rising costs. The reason that the uninsured crisis is so acute in the small business community is because insurance has become unaffordable for too many small employers. But this bill doesn't really address that. You referenced the tax credit that's available. The tax credit is so narrowly focused and tailored that the CBO estimated only 12% of small businesses could even qualify for it. So it's really a tax credit in name only and isn't going to do too many people that many favors.
So you're saying, let's just take, for example, right, there's a gym down the street from here. Small business, it's a gym, he's got 10 employees that work for him. He wants to be able to provide health care for his employees. You're saying it won't apply to him, that he won't get a tax credit back?
It depends. There's a number of hurdles. One, the number of employees. Two, how much you pay the employees, and there are several other factors that go into that consideration. The reality is the tax credit isn't a bad idea in of itself, but they've made the qualifications so restrictive. There aren't many employers who are going to be able to take advantage of it, unfortunately.
Well, the health care costs, let's say that this bill didn't pass. The health care costs are already soaring for individuals out there who've got to pay their own COBRA health care plan because they may be at an employer who's not giving them health care insurance, right? So those costs are already soaring. So something had to get done in order to sort of get people covered, because if people aren't covered and they're going to a hospital, I'm ending up sharing that burden.
Right. No, absolutely. And we've been screaming on the street corner for anybody who will listen that we need comprehensive reform going on 2 decades now. But again, this is the kind of reform that is going to penalize the private sector. There's very little in terms of cost containment, and so those rising costs we have already are going to continue to rise. And when the president stood up and said that, we're going to rein in healthcare costs, and if you like your plan, you can keep it. I don't know how he did it with a straight face, because there's nothing in this law that's going to protect those things.
Well, let's talk about those exchanges that'll be available to the marketplace, and why not create more healthcare companies out there and these exchanges, because we know the more exchanges we have, the more companies there are to choose from. People like Aetna, health insurance, these big, huge companies can't charge us and can't raise the rates.
Right, and that is one positive area that we like about the law. If done correctly, the exchange can foster more competition and choice for the consumer, which are small business owners and their employees. So there is a potential to do this, if done correctly, where it could work out for the consumer. But as with anything, the devil's in the details. And so if we don't get it right, we'll end up in the same situation that we're in now.
One real model that we can look at here. Let's go to Massachusetts. Let's look at what Mitt Romney did. It is mandatory that everyone there have health insurance. You will be charged. You have to pay. Otherwise, you get penalized, and they'll take it out of your tax deductions, right? When you come back, you have to have health insurance. You don't see that as a good plan?
Well, I think Governor Romney would be the first to tell you that his plan has problems, and hindsight's 2020, and some of the things that they've done in that law they probably wouldn't do again if he had to do it over. There are a number of examples to look at. Massachusetts, Utah, other states are a little bit ahead of us in terms of the exchange process. We are working with the governor and his office and the legislature and other interested parties to try to formulate an exchange that takes the best of what other states have already done, so that at the end of the day we have an exchange model that works for individuals as well as small business owners.
All right, and I'll quickly ask you, there are some people who like the fact that kids age 26 can stay on their parents' health care coverage. There are people like that you don't have to have pre-existing conditions. If I go to a health provider, they can't deny me anymore. Right. Do you agree with that or no?
Well, again, those are all coverage issues, and they're important. Obviously, they were identified as policy priorities, but they don't get at helping us control costs. And if at the end of the day health insurance continues to be too expensive, people can't afford it, people aren't going to buy it, our uninsured population doesn't get any smaller.
All right, Kyle Jackson, thank you very much for joining us, getting your side of the story. Thank you very much. And when we come back, hear directly from a small business owner who is concerned about his bottom line.